My name is Dr. Sanjay Gupta. I am a senior physician in Stanford Hospital in Kaikondrahalli, Bangalore. I have done my specialization in internal medicine. Headache is a very common symptom of patients coming to the hospital. And the headache can be classified and categorized in many different ways. It is also one of the challenges for a doctor to find out the cause of headache and to investigate and to treat it. Well, most of the cases can come with unilateral headache or bilateral headache. And the commonest percentage of these patients fall into a category called migraine. As everybody knows, that migraine has got various aspects, various precipitating symptoms, various signs, various manifestations and various types of treatment. But it is a diagnosis of exclusion. So we have to find out what is causing the headache and what is triggering it and what can be the best possible fit of treatment. Now, it is very commonly seen that people have upper GI distress and lower GI symptoms associated with headache. But it's quite difficult to say that what is the cause and effect. I would say that I developed acidity and then headache. And somebody else will say, I had a headache, then I developed acidity. Well, it's a matter of how we understand the patient's conditions and how we treat him accordingly so that he gets relieved of his headache. It's not only the headache but the upper GI distress, so-called acidity, most common symptom in patients. But when you try to correlate it, then a lot of physiology comes in between. Like, for example, sympathetic stimulation. Sympathetic stimulation of the upper GI and the neurovascular system is also one of the very common manifestations if you look at the cause of these problems. But yes, people do say that they have taken an antacid or they have taken a proton pump inhibitor and they have got relieved of headache. It is almost that what came first. But eventually what happens is you are allowing the stomach to feel better. You're allowing the stomach to have a good gastric emptying time. You're allowing the small intestine to function normally when you take these medicines for dyspepsia. So I'm saying dyspepsia because that actually involves a lot of symptoms of people coming with headaches. And it is not only a monotherapy. So I would like to say that when we deal with headaches and with people who are saying they have acidity, it is not a monotherapy, it's a polytherapy. We have to give a combination of medicines. And by the way, the most precipitating factor for all these is stress. So stress is the most important culprit in people's lives who come with these two problems. And we should not take this lightly because these symptoms coming frequently, these symptoms worsening can also signal other diseases, other more morbid diseases which should be diagnosed in time. So I would suggest that a medical practitioner should be involved when these symptoms come frequently in combination.